Hey guys, Dr. H at ISL. You may notice a little bruising and swelling on the left side of my face. Fell this week while running. Doing great. Life goes on. The theme of today's Best of ISL video series is that of the voice of nursing. In this video, you will hear from a nursing faculty member, a master's nursing student, and a few BSN nursing students, all sharing the value of the clinical experience with international service learning. For most nursing students, you may wonder, how will a international service learning trip help me with what I'm learning in school? Well, you'll hear from the nursing faculty member and the students equally how the course content in nursing programs really helps you in the clinical setting. And this is where it all comes together. I always share with my nursing students that it takes 1 year to 2 years before you really feel that you're working as a nurse, because when you graduate school, you have a lot of book knowledge. Then it takes some time to match that up with the clinical skill sets. In this video, you'll hear where the students feel they get an edge from being on an international service learning trip because they're pulling together what they've learned in school and what they're doing in the clinical setting, and it's all making a lot of sense. Enjoy.
Well, a lot of students think they're going to come in and treat, 500 patients in a day, and the patients are all going to be lined up. But the experience is just a little bit different, but the patients truly appreciate it because the doctors spend 50% of their time teaching the students and 50% of the time taking care of the patients. And so the patient load is a lot less, but the students learn so much, physical assessment-wise, diagnostic reasoning-wise, how to come up with a medical diagnosis, and then how to develop a plan of care. So I really think the students get a lot out of it.
I feel like when I get to my pediatric course next year, I'm going to know so much and be so ahead of the curve because, this is how you assess the baby. This is what a child's heart rate is like compared to an adult's. Just simple things like that is going to give me such an edge next year.
To see what ISL does for the community is amazing. I mean, it's really great, and it's just, they've done such a great job of being able to schedule us and put us not only where we need to be, but where we will benefit the most, and that's what's been really great. ISL's done a great job.
I would recommend this to almost anyone who is going through nursing school. I have had one of the most eye-opening experiences here. I've gotten to work with everything from peds to geriatrics. I've learned so many new skills and become so much more confident in my own skills that this is something that I would recommend to anyone who has the means to do it.
Great. It puts together everything that you've learned, from your foundations of nursing classes to, assessment and the pathophysiology that's behind it, and then the pharmacology with the treatment plan. And then the doctor will come over and then tell the doctor what you think the problem is and what you would like to see for the course of action. And the doctor will either agree with you, or they'll kind of steer you in oh, maybe it's this instead, and it puts everything together and it fits in all of the pieces. You basically get to use everything you've learned, so it's great.
I became a nurse because I love helping other people, and so ISL, incorporating service into learning, is a really important aspect for me. Helps build our characters as people, us in the nursing student group, and also as a nurse practitioner.